All right. Hello, hello, hello. How's everybody doing? Let me know you can hear me. Good evening. Good evening, everybody. I see Miss 412 baby. So you made it. I remember we were talking under the comments. You said you want to set your reminder and you made it. Welcome. I'm glad you made it live. Hey, Rashawn. I hope I'm saying that right. I see you're here and you just passed the test, right? So you took your you're now studying. You passed CCMA. You're doing CMA as well. Oh, you're doing the administrative. Okay, I see what you're saying. You're doing the administrative part as well, Rashawn. So you're watching from Wisconsin. Glad you made it live, Rashawn. Brenda, hey Brenda. Brenda's from Cali. Okay, so you're about to do your externship. Okay, good luck with that, Rashawn. Hey Kathy. You're done with externship, working on studying for my certification exam. Got you. Kathy, which one are you taking? CCMA, CMA, RMA? Which one? Which one are you taking? Guys, I went on ahead and started a few minutes early today. We're not going to be on here long. I know sometimes we've gone like an hour and a half. We are definitely not going to be on here long today. I want to try to get through this hopefully in about 45 minutes. So we're going to go ahead and get started. So you can go ahead and continue to let me know where you're watching from and your status. If you have any questions, as always, feel free to leave them in the comments. I will address them after. We'll go through the study questions first, and then I'll answer any questions at the end. So Kathy's from Circle Pines, Minnesota. Is that Minnesota, right? Oh, hey Sophia. I hope I'm saying that right. From Iowa, welcome. All right, guys. So we're gonna get ready to get started. So if you've been here before, you already know how it goes. We'll go through some questions together. I'll give you guys a few moments before I reveal the correct answer. Give you guys a few moments to answer the questions, right? And I am doing it open ended. So I told you guys, going forward, I'll do it open ended as opposed to multiple choice. If you like the multiple choice way, those videos are still available, but this way, and I've gotten some good feedback from you guys as well. You guys have been telling me that this is helpful because it's making sure it's helping you to make sure that you know the information as opposed to seeing the option and choosing from it. So I'm going to keep doing it this way. Plus, this is so much easier for me to prepare these slides without the multiple choice questions because it took me hours to create those slides. So this is much better too. Hey, Veronica. Yes, my day was good. It was busy. I literally just got in here and got settled, Veronica. I hope your day was good too. Hey, Fartune, you made it. Fartune, hey, Fartune and I, we just had a one-on-one session yesterday. I'm glad you made it, Fartune. All right, guys, so let's get ready to get started. All right. So shout out to Natasha. Natasha passed her exam. She didn't tell me which one she passed. Tashina passed her exam. Let's see. J and B, congratulations. El Hala, congratulations. Layla, she passed her test. Congratulations. So if this is your first time here, I always shout out people that passed their test. What's that? XXK passed their CCMA exam. Lawrence passed her CCMA exam. Jayla, Veronica, who's on here now, she's also my live moderator. She passed her RMA exam. Congratulations. I know my worth. Passed her exam. I'm guessing it's a her. I'm sorry. If you're he, I'm sorry. Stephanie, congratulations. Rashawn, who was on here, also passed. Daniela and Indigo. I just want to send a special shout out to Indigo. That 481, that's an almost perfect score. 500 is the perfect score. So that 481 is excellent. I don't know if Indigo's here. Indigo is normally going here. Congratulations to everyone. And if you've passed, just make sure you comment in the regular comments so that way I can shout you out just like I'm doing now. Okay, so congratulations to everybody. All right, so a few tips. You guys know how I do. A few tips before you begin. Let your life revolve around the study material. If you're not in any medical assistant Facebook groups on Facebook, you want to, kind of join and network with other MAs because I always see people asking, hey, anybody have any study questions they can send me? That's one of the reasons why I say network and Facebook groups. One of them is called Medical Assistants with Experience Networking Group. The founder of that group, I actually had him as a guest a couple what was last month, a couple months ago. Mr. Lawrence, he was on here. He's the founder of that group. That's Medical Assistants with Experience Networking Group. That's a good group. Also pay close attention to the wrong answers on the practice test. Do not focus more on the questions than you do the actual content. Create flashcards and let somebody quiz you. Pay close attention to each question, recognizing keywords, use process of elimination, and answer easy questions first and flag difficult questions to come back to later. This is so you can do that on an actual test as well. Flag those questions. You can bookmark them and come back to them. Let's see. Oh, yes, it works this way. Yep, Veronica said it works this way. Rashawn said, yes, you need to know the content very much. You're welcome, Veronica. Oh, you went on 2 interviews. Let me know how it goes if you hear anything back. Miss 412 Baby says she's calling from Virginia and she's taking her CCMA test in November. So you already getting a head start on this. I love it. Sophia, she's starting on 9/12. Oh, you getting a head start too, Sophia? I love it. She's watching from Oregon. So I have had quite a few people to tell me that they're just about to start school or just now starting school and they're already getting a head start. So I love it. I love it. All right. True or false? Patients feel electrical impulses during the EKG. Is that true or false? When you're doing an EKG on a patient, do they feel electrical impulses? And yes, this is on the test. It may not necessarily be on your test. I just want to reiterate every test is different. So you may not feel this. I'm sorry, you may not have this, but it's on the practice test and study guide. So it's a possibility that you may see it. Is that true? Do patients feel electrical impulses during an EKG? All right, I'm saying mostly false. Let's see. Yeah, that's false. Patients don't feel anything during the EKG, even though we are recording the electrical activity of their heart. They don't feel any electrical impulses. I'll share a funny story really quick. So I Nova, the cardiology practice I was working for full time. I'm now PRN with them, but I was working for them full time some years ago, and we had, I don't know where you guys are from, but I'm from DC, so our team here is Redskins, now called Commanders. But anyway, we had contract with the Redskins, and so we would do their physicals. And so it was so funny. We were doing an EKG, and these guys, these big, strong guys, they were so afraid to get an EKG. Some of them thought that we were going to shock them. It was just hilarious to see these guys afraid to get an EKG. But it's true though. Some patients they kind of brace themselves and they think that they're going to get shocked, but there's no shock. Okay, we're recording the electrical activity, but you do not feel anything. Okay. All right. A patient comes in with a wound that is bleeding profusely. What's the first step you as the MA should take? Oh, Veronica said it is on the test. So you did see something like that on the test, Veronica? A patient comes in with a wound that is bleeding profusely. What's the first step that you're going to take? What are you going to do? So you're an MA, patient comes in, they have a wound and it's bleeding profusely, like large amounts of blood is coming out. What is the first thing you're going to do? And so this is what I meant in those tips when I said pay attention to keywords. This is what I mean when I say that, the first step. So there are different things you're going to do. So you'll see the question, it'll have different options of things you can do. And some of those things, everything listed may be things that you're going to do, right? However, the very first step before you do anything is going to be what? Hey, Jerkita. Okay, I see apply pressure, apply gloves and pressure, stop the bleeding, try to stop the bleeding, put pressure. Okay, let's see what the answer is. So first you're going to put on gloves and then you apply pressure. So if you see this question on the test, you will see put on gloves. You'll see apply pressure. You'll see clean the wound. You'll see all those things, right? But what is the first thing? Before you apply pressure, you're going to put your gloves on, right? Anytime we're dealing with bodily fluids, we're going to put on gloves. So yes, you guys are right that we're going to apply pressure, but the first thing you're going to do is put on gloves, okay? Don gloves and apply gauze to apply pressure. Exactly, okay? It's the very first thing you want to do. So, and again, just pay attention to keywords like first or initially. All right, at which angle should you insert an IM injection? Which angle? So And one of the reasons why I say pay attention to stuff that's on these practice sets, because you want to make sure you know it. As we're going through this, you should have a pen and paper out. Anything that I say that you didn't know, that anything that I go over that you didn't know, you should be adding that to your notes, right? So if you didn't know that gloves was the first thing, you should have written that down. Even now with the angle, if you don't know the angle for IM injection, once I give you the correct answer, you should be writing that down. That's part of studying. As you're going through the practice test and study guide, and even videos like mine, have your pen and paper out and take notes. That's how you study. All right, let's see. 90-degree, exactly. Everybody that listed got it correct. Hey, from Texas. I don't want to say your name incorrect, Miss Neil. Welcome. Yep, 90-degree angle. Intramuscular is 90-degree angle. So if you did not know that, add that to your test. I'm sorry, add that to your notes. At which angle should you insert a sub-Q injection? Subcutaneous. So IM was intramuscular, right? 90-degree angle. Make sure you know all of your angles. Okay. Can you say what we do in order? I'm not can you say what we do in order? As far as the as far as if a patient comes and bleeding, putting your gloves on and then applying pressure. And then because it's a wound like that, the provider will take over. So you'll just initially, put your gloves on, assess the, apply pressure. The provider is going to be the one that's going to assess the wound, because they may end up having to go to the emergency room depending on how deep the wound is. But again, that's going to be assessed by the provider. All right, let's see. So 45 degrees, that's correct. Subcutaneous in general is 45-degree angle, right? It's given at a 45-degree angle. And insulin, though, is given at a 90-degree angle. Okay, so that's the exception. So make sure you know that 45-degree angle, okay? Subcutaneous injections are given at a 45-degree angle, with the exception of insulin. Insulin is a sub-Q injection, but is given at a 90-degree angle. Oh, congratulations, Jarkita. Did I shout you out already, Jarkita? If not, make sure you put that in a regular comment so I can screenshot it and shout you out. I can't remember. Yep, so 45 degrees. All right, true or false? Schedule 1 drugs have no accepted medical use. Is this true or false? So again, another thing you want to add to your notes. If you don't know your schedule 1, 2, 3, 4, and 5 drugs, you want to make sure you add that to your notes. You want to know what types of drugs are in each schedule, okay? So again, as we're going through this, when you see things you didn't know, make a note to go look that up. So schedule drugs. You got to know different examples of drugs that are in each schedule. Yes, this is the study for CCMA. Yep. And so I don't know if you joined my live before, but the way I'm doing it now is more open-ended like this, as opposed to the multiple choice questions that I was doing before. Hey, Andy from Queens, welcome. Jarkita says she can't hear. Can you guys hear me? It may be on your end, Jarkita. Let me know if you guys can hear me. I just want to make sure it's not, I want to see if it's me or if it's just maybe she needs to go out and come back in. Let me know if you guys can hear me. Okay, yeah, Fortune said, okay. Randall says, yes, Miss. Okay, gotcha. Okay, yeah, so Jarkita may need to, let me let her know. All right, I'm just typing here for her to go out and come back in. All righty. Oh, okay. So you said this is your first time I've been watching. Oh, okay, cool. Okay. Welcome. I'm glad you made it live this time. All righty. So that was true. So schedule 1 drugs, I just went back for a second. Schedule 1 drugs have no accepted medical use. So schedule 1 drugs are those illegal drugs. Okay. That's like your heroin, um, ecstasy, and things like that. Marijuana is still considered a Schedule 1 drug, even though it's legal in most places now, but that's still considered a Schedule 1 drug. But again, make sure you go. Oh yeah, somebody just put that. But isn't marijuana Schedule 1 drug? Believe? Yeah. Yep. It's still in schedule. It's still considered a Schedule 1 drug. Remember, That's just recently that marijuana became legal. They may change it eventually. I'm not sure. But yeah, it's still considered a Schedule 1 drug. All right, what's the normal range for hemoglobin levels in females? Again, another thing you want to make sure you know. So you need to know the range, hemoglobin levels in females. What is the hemoglobin, the normal range for hemoglobin in females? So if you see a question that says a patient has a level of 8 or whatever, is this normal? Then once you know the range, then you can answer any question about whether a certain number is low or high, right, or normal. This is why you want to make sure you know those ranges. You have to know the ranges for male and females because they're going to X on the test. Okay. So you got to know the ranges for both males and females. Okay. So what is the normal range for females? Okay. Let's see. Yep. 12 to 16. 12 to 16. So make sure you add that. If you didn't know that, hemoglobin level 12 to 16, add that to your notes. Okay. Again, as we're going through this, everything you see that you don't know, add it to your notes. And the hemoglobin for males is going to be 13 to 18. So add that to your notes as well. Hemoglobin for women is 12 to 16. Well, females, 12 to 16. Males is 13 to 18. Okay. All right. Another one. The normal range for hematocrit in females. This is another one. You need to know this range too. What is the normal range of hematocrit in females? Oh, welcome. I'm sorry, I don't want to say your name incorrect. Ronnie Lynn, I'm sorry. I don't want to say it wrong. But welcome. I'm glad you made it. Will there be a video on this? So Bambi, I can do I'm planning to do another video where I just give all the list of all the range. I'm gonna make a list of every blood test that you need to know the ranges for, and I'm just gonna go through them. So yeah, I can do that. I have it as a note in my list of videos to do. So I do plan on doing that. Doing a list of all of the blood ranges because you do need to know your blood ranges, your blood test ranges. Alrighty, so let's see. So yep, it's 36 to 48. Okay, so that's for females. Hematocrit is 36 to 48. 36% to 48%. And males is 42 to 52%. Okay. So females, hematocrit is 36 to 48. And males is 42 to 52. Okay. So you want to make sure you know these ranges for these, and then glucose ranges. What else? Cholesterol. Um, what else? Potassium and sodium and things like that. All of those ranges are on your study guide. This is why I always say make sure you have access to your study guides for the test that you're going to take. If you guys didn't already see, I did a video the other day, the top some of my top study tips. And the very first tip I always say, make sure you have access to the study guide for the test that you're going to be taking. So if you're taking the CCMA, right, you should be on NHA's website, going through that study guide. All of that stuff is in there. The ranges that I just mentioned are there. If you're taking the CMA, you should be on the AAMA's website, getting those study guides and practice tests. And then RMA, you should be on AMT's website, okay? You got to make sure you are accessing a study guide. Again, if you are taking the CMA and RMA exam, those exams are more broader than the CCMA. And so there's going to be some stuff on those tests that I may not cover because I strictly focus on the CCMA as well as the CMAA, which is administrative certification. Sophia says, I don't know how to organize all the notes I have. Do you plan on doing organizing or note taking one? Sophia, are you the one that told me you just started with your program or about to start with your program? I'm just trying to remember because you're going to be a little different. So you said, I'm just scrolling up to see. Yeah. So you just started you're about to start your program. So yeah, so you'll get, when you start your program, you'll get organized by class. So you'll have, I recommend having different notebooks. Like you may have your terminology notebook, then you'll have your phlebotomy notebook, or your administrative notebook. But that's one of the ways you want to organize, is by class. And I don't know how your school is set up. Schools that go in order, a lot of times they'll start with administrative and terminology. So you'll do that stuff first, and then you'll get into like medical law and stuff like that. And then you won't get to this stuff like and probably until later, depending on how your school is set up. But it'll come. Hey, Jackie from Forest, Virginia. All right, so you notice a patient's lab results have come back critically low or critically high. What's the first thing you should do? So your patient's lab results have come back critically low and or critically high. What's the first thing you're going to do? So you got lab results over the fax machine, or if you have an EHR, if you're working on an EHR, they may have just populated into the patient's chart, or maybe they came by mail. What is the first thing you're going to do? Very first thing you do. Okay, I see some people saying inform or notify the provider. All right. Always going to be notify the provider. Or if you see the option that says place the results on the provider's desk, that as well. So could be worded a couple different ways. So on the test, it may say something like patient results came over abnormal. And you may have to recognize that the result is abnormal. It may not, the question may not say is abnormal. The question may say a patient's glucose level results have come back at 200. You knowing that that's abnormal, it may say, what do you do? It'll say something like, make a copy and put it in a chart, call the patient, notify the provider. You know that's abnormal. You need to notify the provider right away. It may be worded in a sense where it says, what's the first thing you do when you get results? It may say, put a copy in a chart, call the patient, put it on the provider's desk, or notify the, or you know that it's always going to be either one. They're not going to be, under the same questions. Either going to be one or the other, either notify the provider or place the results on the provider's desk. So that's always the first thing you do when you get results. You never just file results without having the provider's signature or initials on it. Okay. Ms. Neal says I'll be taking a CMA on a. Okay, so if you mean NHA, that is the CCMA, the Certified Clinical Medical Assistant. You want to take it before the end of the month. Okay, so you worked at, okay, perfect. So yeah, if you're taking a CCMA and you already worked as an MA, that's perfect. I always recommend taking the CCMA if you've already worked as an MA, because it's a clinical certification. So yeah. Yeah, on the NHA website, that's CCMA. The CMA is on the AAMA's website. Oh, she said, what was the question again? What is the first thing you do if you notice abnormal results? So the patient's results are critically low or critically high. What's the first thing you do? Yep, the patient's hematocrit was critically low. What do? You notify the provider. That's correct, Kathy. And on the test, it may not say, it may not word it like that. The hematocrit was critically low. It'll give you a number, and it'll say, okay, this patient's hematocrit level was this. What do you do? Now, since you know the hematocrit range, you'll be able to look at that number and determine whether it's low or high. If it's normal, then you'll know that. If it's low or high, then you'll know that, just because you know the range. And this is the reason why I'm doing it in an open-ended way, because when you know it, you know it. When you know the information, you know it, no matter how the question is worded. Okay, next question. All right, convert 5'7" to centimeters. So the patient is 5 feet 7 inches. Convert it to centimeters. If you don't know how to do this, better take a note. You got to know how to convert to centimeters, and feet to centimeters, or inches to centimeters, and vice versa. Centimeters to inches, inches to feet, and vice versa. Oh, Samantha says, I just found videos 2 days ago. I've been watching them like crazy. I have 1 month left to take my CCMA videos out. Oh, thank you, Samantha. I'm happy to help. You're welcome. I'm very happy to help. I'm glad you caught live today. Normally I go live later, but I'm deciding to do it earlier now at 6. So this will be the new time. Unless I have to go live later. All right, let's see. All right, so yep, those of you that said 170 is correct. So 170.18 is the exact answer. And of course, when you round it, it's just 170. So what do we do first? First, you want to convert that 5'7" to 67 inches, right? 5'7" equals 67 inches. And to convert inches to centimeters, you multiply by 2.5, okay? So if you're converting inches to centimeters, you're multiplying 2 by 2.54. So how do you convert centimeters to inches? The opposite. You divide by 2.54. So that's another thing I mentioned in my top study tips video. Make sure you know these conversions. I'm going to do a video where I'm going to tell you everything that you need to know, just some foundational things that you need to know for every test. And this is one of them, knowing how to convert inches to feet, feet to inches, centimeters to inches, and vice versa. Okay, pounds to kilograms and vice versa. You got to know Celsius to Fahrenheit and vice versa. Okay, got to know these. All right. In which position would you place a patient for an enema? Guys, do me a favor. If you're enjoying this, if this is helping you, exit out the chat and like the video for me, guys. If you're enjoying this, just exit out the chat and like the video for me. Thank you. Okay, let's see. Okay. You guys are correct. It's Sims. Another one, you want to make sure you know those positions, know all of your positions. So this is good. You guys knew that one. Make sure you know those positions, okay? So you'll see questions that's similar to this. What do you do? What type of position do you place a patient in for such and such exam? Make sure you know each of those positions, okay? Let's see. All right, so which position would you place a patient who's having trouble breathing? Another positions question. Oh, Miss Neal, thank you. She said I've subscribed. Thank you. Oh, Shanae says she's taking her CCMA on Tuesday. Okay, I wish you the best, Shanae. I see Veronica says good luck, Linda. I don't see Linda's comment, but good luck to you, Linda. All right, so let's see. Yep, so there's going to be semi-filers. It's going to be semi-filers. So filer is sitting straight up. Semi is when they're kind of halfway. Note semi. So filer is sitting straight up, and then semi is kind of halfway, right? Make sure you guys know those positions. Thank you, Kathy. Filers is 90-degree and semi is 45-degree. Thank you. All right. What are some examples of a CLIA-waived test? If you don't know what a CLIA-waived test is, then you need to write it down. What are some examples of a CLIA-waived test? What is a CLIA-waived test? And what does CLIA stand for? You guys should know what CLIA stands for. If you're looking at this and you wondering what CLIA is and you're about to take your test, you need to be writing that down to make a note to go look up what CLIA is. If somebody they can write it out in the chat if you feel like writing CLIA out for me. So I see you guys are giving me some examples. If you don't mind writing out CLIA for somebody who may not know what that is. I know a few of you said that you are just about to start your MA program, so you may not know what it is yet. I love that you're getting a head start on it. I think that was Sophia. I know Sophia, she's getting a head start on her program. Alrighty, see some examples. All right, let's see. So, yep, rapid strep test, urine pregnancy test, fecal occult blood, glucose monitoring. So these are things we can do in the office. So CLIA-waived tests, those are tests that are simple. Those are simple tests that can be done in the office, right? We don't have to send it off to a lab to get tested. We can do it right in the office. Now, one thing I didn't put on here, I missed. Well, I didn't put everything on here, but one of the things too I want to mention is the urine dipstick. So you have the urine dipstick we can do in office, and then you have the which we do like a quick look at the urine, and it can show us how much protein is in the urine and things like that, glucose and stuff. But then we have the UA, which is urinalysis. That's not a CLIA-waived test. That UA is actually sent off to the lab. Oh, thank you guys for writing it out. Clinical Laboratory Improvement Amendment. So if you didn't know what CLIA stood for, make sure you add that to your note. You need to know that. And so that's what CLIA-waived tests are. Those are simple tests that can be done in the office, okay? Simple tests. All right. How do you properly verify your patient's name and date of birth? What's the proper way to verify it? And yes, this sound like something very simple, right? But it is it's on the practice test, so obviously it could possibly be on the actual test. Oh yeah, COVID test is one of them, Kathy. Yep, I see that. COVID test is one of them. UA, yeah, UA, the U, well, not your the urine analysis that we send off to the lab, no, but yes, the urine dipstick, yeah. Okay, somebody says ask them, spell their name. Somebody said driver's license. Yeah, so you're gonna have them state his name and date of birth, okay, and spell his name. So driver's license, yeah, we'll get a copy of that and we'll verify his demographics and everything like that. But just obtaining a license is not a verification. You always want to have your patient state the name and date of birth. This is one thing I always reiterate to my students. Never say the patient's name and date of birth for them. Let them say it. And I'll tell you why. Some years ago, I called the patient back to the room. She was an older patient. Called her back to the room. Once I got her back to the room, I verified her name and date of birth. When she said her name and date of birth, she was a completely different patient from who I called. The patient I called was actually in the bathroom. She was hard of hearing, and she thought I called her name. Now, if I had brought her back and I said, "Hey, are you Mary Johnson?" She probably would have said yes because she's hard of hearing. So always, and then also think about it like this too. You've just given somebody else's name. So let's just say you're saying, "Are you Mary Johnson?" And that's not Mary Johnson. You've just exposed Mary Johnson's name. Okay, so we talked about HIPAA and confidentiality before. Yes, is that serious that we can't even give out a patient's name? So no, we're not going to say, "Hey, are you Mary Johnson?" You say, "What is your name and date of birth?" And you have them stated their name and date of birth for you. Okay. I'm always reiterate that because in class I've had students, they pair up and they, working on each other and different things like that. And I heard people say, "Hey, is your name such and such?" No, you let them state it to you. Okay. Oh, Miss Neal said that happened to her before because someone had to say, "Oh yeah, it's the same name and date of birth." Oh yes, that can happen. Yes, you are so right about that. Same name and date of birth. Yep. In that case, you got to go by a middle initial or last four of their social. I don't know how your office did it, but we would go by a middle initial or the patient's account number. All right. Okay, true or false? In a professional letter, the entire text should be flushed to the left. Oh, was it? Wow. This a great example right here, Ms. Nash. She read off the medications and it was different. Wow. They probably was like, "No, don't take that. What is that?" Samantha says, "I live in Texas. Some of our offices are giving patients stickers. You will read their stickers and verify." Got you. Okay. Asking in private since it's protected, Kathy. Yep. Wow. Miss 412 baby said that happened to her too. Dang, the same middle initial too and birthday. What in the world? Y'all know what was funny? I had a father and son who had the same birthday. They had the same name and same birthday. Ain't that funny? Father and son, same name and birthday. And I worked in cardiology, so we got pretty much we would see a lot of the same patients over and over, and they often came together. They I think I want to say the father, he was coming like every 3 months. The son, he was on like a every 6 month type of thing, and they would often come together. Same name and date of birth. Hold on 1 second, guys. Go ahead and write your answers in. I'll be right back. Hold on 1 second. Okay, guys, I'm back. Entire text should be flushed to the left. Let's see what you guys are put in. True or false? I see mostly true. I see a false. So in a professional letter. Oh, that's a good question, Kathy. Kathy said, are you talking full block or model? That's a good question, Kathy. So the professional letter. Which of those are considered the professional letter? Oh, she said I had to redo their whole chart. Wow. Okay, Miss 412 baby said she had to use the last four to social. All right, so this is going to be true. So yes, this is the blocks. This is the block letter, Kathy. This is the block style. The block style is the one that everything is flush to the left. That's the most common. That's the most common, the block letter. Yep. Okay. Now while we're on this subject, in a professional letter, there should be 3 lines between the closing and the type signature. Is that true or false? So this is some of the administrative type of questions that you guys will see. So on the CCMA, like I told you all before, there's not a lot of administration on there, but there are questions about the letter styles and appointment types and things like that. Worked in an urgent clinic, so they weren't seeing the same doctor. I didn't even catch it until it was time for the doctor to go. Wow, that's a good story. Miss Neil, you got to come on the channel one day and talk about that. I don't know. I know you say you just found my channel. I don't know if you have had a couple interviews on here so far. I want to do more interviews with some medical assistants in the field, and I just want to have somebody come on here, go live with me one day and just talk about some of the things they've experienced, some mistakes they've made, and just some things that people can learn from. I'm actually about to start recording more videos, guys, and I'm going to be sharing with you some of my experiences that I've had. I've experienced racism. I've experienced, patient calling me the B word, just some things I'm going to be sharing with you guys. And I want to start having other people come on and just kind of share some mistakes they've made and things they've learned to help you out. Because I did a poll on the channel and I realized the majority of you all are in school or just finished school. And so I want to start doing more things geared toward you all, but also people that's been in the field for a while. Okay. You know what? I'm going to give you my email because I don't know how to message on YouTube. I'm putting my email here. And do me a favor, email me, and then we can figure out some days. I just put it on the thing. Yep, email me. And anybody else that's interested in possibly doing an interview one day, I know I put it out there before. I haven't got to doing them yet. But anybody else that's willing, definitely let me know. All right, let's see. So where were we? Let me go back to this. All right. So that's going to be true. And it looks like you guys said, yeah, it looks like what most of you guys put true. Yeah, so that's going to be true. 3 spaces. Now, so if you see a question that says, um, a block letter and it says something about 2 spaces, then you guys know that's incorrect, right? It's 3 spaces. So again, this is the reason why I'm doing this open-ended type of way, because no matter how the questions are written, when you know the information, you know it. Oh, Veronica said my daughter had that happen recently. A black man told her she's too black to draw his blood. He wants someone else. Oh, wow. I'm sorry to hear that, Veronica. Wow, I'm sorry. Wow. I take compassion and tough skin in the field. Yep, it takes compassion and tough skin. You're right, because you come across a lot of things when you're working with people. You don't know what you're going to come across. A lot of times people are not feeling well. Some people don't mean any harm. They're sick. They're not feeling good, nervous or whatever. And then you have some people that are just outright mean, and it's a lot to deal with. All right, let's see. All right. Needle sizes. A 3/8 to 5/8 inch needle, 27 gauge, is the proper needle for sub-Q injection. Is that true or false? I forgot the true or false here, but let's just say true or false. Is this true or false? A 3/8 to 5/8 inch needle, 27 gauge, is the proper needle size for a sub-Q injection. Wow. I'm just reading you guys' comment. Wow. Wow. Okay, let's see. So I see false. Let's see it true. Let's see. All right, so that's false. So sub Q should be 25 gauge, okay? A half to 5/8 inch, okay? Now that needle size that 27 gauge, that's actually used for intradermal, okay? So another thing you want to make sure know your needle sizes, okay? I don't know if you guys can hear the siren in my background. I'm sorry. I'm sitting in my living room and there's okay, it's gone. All right. So yeah, so make sure you know those gauges and needle sizes, okay? You need to know that for you intramuscular, sub-Q, intradermal. Okay. All right. What's the largest portion of the brain? What is the largest portion of the brain called? The largest portion of the brain. All right. Let's see. Yep. It looks like you guys are correct. Cerebrum. It's also the uppermost portion, right? It's divided into lobes and it's separated into the left and right hemisphere. You guys are correct. You guys are on it. All right. While we talking about the brain, what part of the brain is in control of balance, posture, and muscle coordination? AKA mini brain or little brain. What part is that? All right. Let's see. Yep, cerebellum. Y'all are on it. Y'all been studying. Okay. All righty. So you guys are on it. So listen, ladies and gentlemen, if there's any gentlemen on here, I'm sorry if I said ladies and there's gentlemen on here too, but this is it for tonight. I hope that this was helpful to you guys. Let me know in the comments. Let me know if you have any questions. Um I'm going to do another. I plan to go live, I think, again next Thursday. I'm planning to do more videos now because I have more time. So you guys know I'm an instructor. I teach clinical and administrative. classes, but for some reason right now our enrollment is low, so we just pushed off our start date. We were supposed to start in August, so we've been pushed off because enrollment has been kind of low. And so they have evening classes. I'm not doing evening classes anymore, so I'm waiting for a daytime class. So I have some time now. I'm also working in a doctor's office, PRN. You guys should know what that means, as needed, right? This is a practice I used to work for before. So I have a little bit more time to do YouTube videos now. So you probably noticed you saw quite a few videos from me this week. You'll see more. I want to do more videos. Like I said, I want to have more people on here. I'm going to do some story time videos, share with you some of my experiences. And I'm also going to do some medical terminology videos. I have that coming up, as well as some foundational things that you need to know for the certification. Okay. So I just want to, and you guys can let me know some ideas, some things you want to see on the channel. Let me know, because I don't want this channel to just be for certification. I want it to be for medical assistance, not just fresh out of school, but like Miss Neil here that's been in the field for a long time. Like, I want it to appeal to everybody that's a medical assistant. I want it to just be for medical assistants, period, right? So I did a video the other day about whether you want to be a medical assistant instructor. So that video will be for somebody who's been in the field for a long time. So like Miss Neil, that'll be a video that you'll check out. So I want to do more things like that. That's not just geared toward fresh out of school medical assistants, but just everybody. So let me know, guys, video ideas that you have. Make sure you like the video, subscribe if you haven't already, and share it with your classmates and colleagues. I do have the one-on-one sessions still. You don't have to do that. You can just email me. The one-on-one sessions are for people that want to have that personal time and need that extra, they need me to look over their resume and cover letters and things like that. If you send me your resume and cover letter, I've had some people do that, and I can tell you, hey, it's fine. But if you want me to go into detail with you, you can go ahead and do one of those sessions. Oh, Veronica said, will you ever do phlebotomy? You know what? I can't, I don't have, you mean for the certification? I can talk about phlebotomy, but I don't have that certification. I don't know. Do I have access to that? I don't think I have access to that certification exam. So these are questions that come from the actual CCMA test. Yep. So the study guides and the practice test is where I get this information. Yep, this is exactly where I get the information from. You're welcome, Fartoon. Okay, finish watching other videos. Got you. Oh, I'm from DC. I'm from DC. Let's see. You're welcome, Stephanie. You're welcome, Destiny. Brenda, you're welcome. So for CMA, so I don't go live for the CMA, or do you mean the CMAA, Rashawn? Because I think you said you're about to take the administrative test. You mean the CMAA? I'll do another one of those soon as well. I'll let you know. I'm realizing there's more people on my channel that needs the CCMA rather than the CMAA. So that's why I haven't done as many of those, but I can do more of those. I just don't do as many because most of the people here are taking the clinical certifications. You're welcome, Faith. I'm glad you made it. I'm new to the field. Oh, okay. So you knew. Okay, go back. I have a degree. Okay, I'm glad you enjoyed the healthcare administration already. Okay. Okay, so if you like a one-on-one, that link it should be in the description box. If you like to book one of those, you can do that. Or you'll be taking a phlebotomy exam. Okay, got you. Check out, I know there's some videos here on YouTube. Veronica, check that out. And then also, you don't have access to the study guide because I don't have access to that. Veronica, I can see if I can get access, but I don't have access to it. I can do some like phlebotomy type questions, that's going to be on a CCMA, because there is some phlebotomy questions. You got to know your order draw. You need to know your, additives that's in a different tube. So I can try to come up with something like that, but it won't be all of the information on the test. Okay. All right, guys. Any other questions before I let you go? Let's see. How long has it been? Oh, we did good. 50 minutes. We didn't go an hour and a half today. Don't forget to like the video, guys, if you didn't already. CMAA certificate separately, even though you're in it. Oh yeah, did you take the CMAA exam? So you will write your name, Veronica Dennis, comma, whatever certifications you have, CCMA, CMA, RMA. If you don't have that certification, no, don't write it. I know people that do, but don't. Don't. Don't write it until you get it. I mean, I like the idea of speaking it into existence, but on anything formal, don't do it. Okay, guys, I don't see even though you meant taking the exam. Oh, okay. When you say write CMA, okay, Veronica, I'm sorry, I misunderstood. When you said write CMA, I thought you meant write it. Okay, you mean take it. Okay, I got you. Sorry, I misunderstood you. But yeah, you can take it. You can take that as well. You can take the CMAA as well. If you want to be able to apply to some administrative jobs, that'll look good if you are also a CMA. You don't have to because as an MA, you already get that administrative side. But if you like to, if you want to, go for it. I have both. I have CMAA, CCMA, so it's perfectly fine. Oh, you got one more video to catch them on. That's number 6. Okay, cool. I'm glad you made it, Miss 412, because I remember speaking with you, I think yesterday or day before in the comments. Okay, so Rashawn is medical administrative assistant. Okay, got you. You got that degree. Okay. All right, guys, I'm going to go ahead and end this. Thank you all so much. Look out for some more videos from me soon. I think the next video I'm going to do is the story time. I'm going to tell you guys about the racism I experienced, the discrimination I experienced, and then also with the patient calling me the B word, me and all my co-workers. It was crazy. So I'm going to be doing that video probably, if not this weekend, next week, and I'll be sharing it with you guys. Veronica said, watch your videos, guys. And thank you. I'm glad you're not tired of me yet. My students get tired of me. All right, you're welcome, Tanya. I'm sorry if I pronounced it wrong. All right, guys, you have a good day. And don't forget to let me know video ideas in the comments. You guys have a good day.